Level 0, no pain. Complete absence of pain. You're comfortable, relaxed, nothing bothers you. This is the baseline state where everything feels normal. Your body isn't sending any distress signals, and you can go about your day without any physical discomfort interfering with your activities. Some people are born with a rare condition called congenital insensitivity to pain, meaning they never feel pain at all. Sounds great until you realize pain exists to warn you about danger. Without it, you could break bones, develop infections, or burn yourself without ever knowing something's wrong. Level 1, very mild pain. This is barely noticeable pain. A mosquito bite, a tiny scratch, or that slight muscle soreness after light exercise. You can easily ignore it and continue with normal activities without any real disruption. At this level, you might forget the pain exists for hours at a time. It's more of a mild awareness that something feels slightly off, rather than actual discomfort. Most people don't even bother treating pain at this level. It'll go away on its own soon enough. Level 2, mild pain. Now we're at noticeable discomfort. This includes minor headaches, paper cuts, or that annoying feeling when you sleep in a weird position and wake up with a stiff neck. The pain is present and mildly annoying, but you can still function normally. You might take an over-the-counter painkiller at this level, more to prevent it from getting worse than because it's unbearable. It's the kind of pain that makes you slightly grumpy, but doesn't stop you from working, studying, or going about your day. Level 3, moderate pain. This is where pain starts interfering with your activities. Think toothaches, menstrual cramps, or a twisted ankle. You can still do things, but you're definitely aware of the pain constantly. It's distracting and uncomfortable. At this level, you start actively seeking relief. Painkillers become necessary rather than optional. You might need to modify your activities, sitting down more often, avoiding certain movements, or taking breaks more frequently than usual. The pain affects your mood now. You're less patient, more irritable, and simple tasks feel more exhausting than they should. Your brain is spending energy managing the pain, leaving less for everything else. Level 4, moderate to severe pain. Pain is now significantly affecting your quality of life. This includes severe toothaches, bad migraines, or moderate injuries like a sprained wrist. Normal activities become difficult. You might struggle to concentrate, sleep becomes disrupted, and you're constantly aware of the discomfort. Simple painkillers might not be enough anymore. You're considering stronger medications or medical intervention. The pain is bad enough that you're willing to sit in a doctor's waiting room for hours just to get relief. At this level, you start canceling plans. That dinner with friends? Not happening. Work? You're calling in sick. The pain has officially taken control of your schedule. Level 5, severe pain. This is serious pain that dominates your awareness. Broken bones, severe burns, or intense migraines belong here. You can't ignore this. Every thought revolves around the pain and when it might stop. Normal activities are impossible. You're lying down, possibly in bed, unable to focus on anything else. Reading, watching TV, or having a conversation feels pointless because the pain keeps interrupting your concentration. Medical attention isn't just recommended, it's necessary. This is emergency room territory. You need professional help and likely prescription strength pain management to get through it. Level 6, very severe pain. Pain so intense it affects your ability to speak coherently. Severe kidney stones, major trauma, or advanced labor contractions reach this level. You might be crying, moaning, or making involuntary sounds because your body can't contain the distress. Kidney stones are particularly notorious here. People who've experienced both childbirth and kidney stones often say the stones are worse. These tiny calcium deposits traveling through narrow tubes create pain so intense that grown adults curl up and sob. At this level, you can't think about anything except survival. Your world shrinks to just enduring the next second, then the next. Time moves differently. Minutes feel like hours. Level 7, intense pain. This is where pain becomes almost unbearable. Third-degree burns, compound fractures, or severe surgical recovery without adequate pain control. Your consciousness feels like it's fracturing under the pressure of the sensation. Burn pain is especially cruel at this level. When skin is destroyed, exposed nerve endings scream continuously. Even air moving across the wound feels like torture. Burn victims describe it as fire that never stops, even after the flames are gone. You might enter a state of shock here. Your body starts shutting down non-essential functions to cope with the overwhelming distress. Rational thought becomes nearly impossible. Level 8. Utterly horrible pain. Pain so extreme you can barely communicate. Cluster headaches, nicknamed suicide headaches, belong here. They cause sharp, stabbing sensations around one eye that strike suddenly and repeatedly, sometimes lasting for weeks. People describe cluster headaches as feeling like a red-hot poker being driven through their skull. The pain is so intense that sufferers pace frantically, bang their heads against walls, or engage in other desperate behaviors trying to distract from the agony. At this level, medical intervention is mandatory and urgent. No one should endure this alone. The psychological impact can be as devastating as the physical pain itself. Level 9. Excruciating pain. We're approaching the absolute limit of human tolerance. Complex regional pain syndrome, CRPS, lives here, a condition where the nervous system misfires and sends amplified pain signals constantly, even after the original injury heals. CRPS patients describe burning, stabbing, and crushing sensations that never stop. The pain is so severe that some people choose amputation to escape it, only to sometimes develop phantom limb pain afterward. The cruelty is that even removing the painful body part doesn't guarantee relief. Trigeminal. Neuralgia also reaches this level. It affects facial nerves and causes sudden electric shock-like jolts across the face. Even gentle touches, wind on your cheek, brushing teeth, speaking, can trigger agonizing episodes. Level 10. Worst pain imaginable. The absolute maximum. This is pain that redefines suffering. Severe bone cancer metastases, extreme CRPS flare-ups, or major trauma without any pain management. At this level, people often can't speak at all. They might scream, lose consciousness, or enter complete shock. Bone cancer pain is particularly devastating because tumors grow directly into skeletal structures. Bones have rich nerve supplies, and cancer invading them creates deep, relentless agony that even strong opioids struggle to control. This is the kind of pain that breaks people psychologically. It's not just a physical sensation, it becomes your entire existence. Nothing else matters. There's only pain and the desperate hope it will end. Some torture methods are specifically designed to reach this level. Pain inflicted deliberately to destroy the human spirit. It's suffering without purpose, agony without end. The darkest edge of human experience.